in the line of doctors who randomly you see and happen to meet who are great, right? So first starting off with a normal doctor. I saw a doctor recently, allergy doctor, and I realized she probably knows the stuff she's talking about. She has experience in treating allergies, right? But she's just not so great with people, not really rapport. She sort of did what I asked her to do, put in a referral to ENT to see if they could do anything so I don't have to take shots. Shots take a long time. Medicines, yeah, she understands it's hard to do, but shots you have to be committed for. And I explained, I if you could tell me that this is not going to be forever, it's easier for me to accept, right? But recently I saw a doctor, a family medicine doctor. I usually avoid seeing them because they're just not as specialized in internal medicine. They train over all sorts of stuff in their 3 years, whereas we just do adults. They do a little bit of OB, right? They do gyne, they do pediatrics, blah, blah, blah. But this doctor was great. And later we were chatting, and he said he does have a board certification in lifestyle medicine as well. And we had to chat about lifestyle medicine, how to change people's lifestyles, because that's so important, right? He made a comment, and I completely agree that, look at people in America. They're getting bigger, having more diabetes, high blood pressure. You think that's not related? You think we're getting healthier? But it's just there's no money in prevention, and I completely agree. And he's like, to really influence change, you need to see the person regularly, but it's just most health systems aren't going to pay for that, which is absolutely true. But the whole point is, doctors, how do you judge them? How do you evaluate them, right? You can look through their credentials, like that school looks good. I could tell you there's people who are wonderful who came from bad schools. I know the smartest doctor I've ever met. There might be other doctors who are really smart, like Cherney, who is renowned for being a diagnostician. But Dr. Dave Clark, he went to Caribbean Medical School. Any question I could ask him, any question I asked for residency, he knew the answer, could tell me studies. Brilliant guy, right? How did he happen to be going to Caribbean Medical School? And then later he gets trained in Stanford with pulmonary critical care, and then he works at a Kaiser below his great as a hospitalist, not even as a critical care doctor or pulmonologist. You're like, right? But I think that's the whole thing. How do you choose doctors, right? I think my old response was pick the ones who don't have people skills, but you can't pick that very well until you meet them. But let's say you get a chance to meet them. Those are the ones who are probably more competent medically, right? But let's go a step beyond. At least for me. What do I want from a doctor? And I realize medical competency is not necessarily what I want, right? Sometimes I just need a referral to another doctor, right? I just need to get through the system, right? Or I just need a test order. I don't need medical competency. I would love to have it, but I may not always find it, right? I think that's sort of a different view of the world I didn't have before, where we have different roles in the world for different people, right? Some people are suitable for this role, some people are suitable for that role, right? Say somebody is very detail-oriented and somebody is not. You may not want to have the not detail-oriented person doing accounting. They're just not suitable. But there's probably other jobs in the world that they are suitable for. And that's probably the same with the medical world. There's different doctors who are good at this or that. There's some who could process through lots of tasks very quickly. There's some, because their brain is always turned on, they have to look, that doesn't make sense. That doesn't make sense, right? It's like when we do cross cover in a hospital, when trying to figure things out. You have 100-something patients, you're the only one covering all these nurses' calls. There's different ways doctors do it. Some doctors will look, let me look in the chart, let me read about it, let me get back to you. But sometimes the nurse just wants a Tylenol, and it's pretty easy to give it to them, in my opinion. Those doctors probably may not be good for this role, right? Some doctors triage, right? They're like, okay, assign this patient to this doctor. This patient needs to be seen more urgently. Some doctors don't know how to triage because when they start on one patient, they can't put that away until they go to the next patient, right? They're not good at multitasking. which I'm sure is very good for them in other aspects. Their single-minded focus, right, is very good for the patient that they're focusing on, assuming nothing is urgent. So that's why I think that maybe there's roles for different doctors and different types. And I'm beginning to realize maybe I want different doctors in different situations depending on what I need.